Hi, my name is Ayesha. I'm based in Goa, India. I am a reflexologist. I treat people with reflexology. My studies has been in acupressure and reflexology. My specialization are in three parts. A. Autoimmune conditions, B. Psychosomatic conditions, and 3. Geriatric conditions. In autoimmune conditions, I have worked with lupus, Graves' disease, Huntington's, Hashimoto, and even diabetes. Now the diabetes is also part of autoimmune family. So I have treated all these conditions. Some could be managed, some could be treated. But with reflexology, you can bring patients' health to a normal lifestyle. That I have been doing for a long time. I'm able to help a lot of patients with autoimmune conditions. Some conditions can be treated and some conditions can be managed. It all depends at what level we are starting reflexology and how regularly we are able to work together. In geriatric conditions, I have been working with Parkinson's, dementia, Alzheimer's, balancing issues, anger management, polypharmacy cases. I have been working with all these cases. And lastly, with psychosomatic conditions. So in this category, I have been working with anxiety issues, depression, insomnia, bipolar conditions, migraine, allergies, asthma. All these conditions also come in the same category because these are all aggravated and influenced by the very common factor stress. So by and large, I work with the wide range of health conditions and problems. But this is what I have to say, that anything which has to do with your mind, body and soul, reflexology can help there. So for those who are knowing reflexology for the first time, this is what I do. For me, your body chart is based in your feet, in your soles. And by doing a stimulation and putting the right amount of pressure at the right pressure points, I get to address the health condition. So why reflexology? Why it's different than any other treatments? So when I am working on your health, I am not only working on your health area, which is the problem area. I am also helping you to regularize and strengthen your overall anatomy. Your overall health becomes stronger and better. How? So what happens during a session? How does it done? So a patient can lie down or sit. I need to work on their feet, preferably below ankles. In some cases, maybe below the knee, especially with senior citizens. But most of the time, it's below the ankles. And in your soles, on both sides, on your feet and your soles, I will be working. One average session goes for 45 minutes, but I ask everybody to keep 1 hour for me. And mind it can be a little sensitive on some pressure points, but it's not painful. In fact, it's very relaxing and a patient starts feeling the changes at the same time when the session is going on. Also, it gives a multiple benefits as the session finishes. Reflexology is the most safe yet very effective treatment therapy. Why? Because it is non-invasive, it doesn't need any intake, it doesn't need any machinery, it doesn't need any kind of external help. It's just me and you, and we work together. So it's the best therapy I have ever come across, and that's why I fell in love with it. Reflexology can also be used as a preventive care. People who are in their healthy years and a good health, if they adopt reflexology, it just ensures a very good course health which is strong and strengthened for the future. So what do I expect? After the first session, after first few sessions in fact, a person feels very happy, the sleep quality gets better, your body feels light, acidity goes down, a person is overall happy and relaxed. That's what reflexology is. Few initial changes start to happen. Where? So I am based in Goa. I have a clinic here. In North Goa, I am based in a place called Porvoori. You can find me on Google and Instagram. My address and details are there. You need to have an appointment with me. Apart from this, I am also traveling in India and out of India. I can be hired as an exclusive reflexologist and we can discuss the case studies and plan the trip ahead. Ideally, I expect to engage with 5 to 10 patients in one trip. These are outdoor trips. And a minimum commitment of 7 to 10 days, because then I am able to do a constructive work with the patient. Please note, when you are adopting reflexology as your regular treatment therapy plan, do consult with your general physician or family doctors that you are going into reflexology. And I strongly advise you to continue with your ongoing treatment, medication procedures until your physician asks you to drop it or reduce it. Thank you so much for watching this video. I'm seeing you soon, so that time we can discuss more, talk more about the reflexology and for the health problems ongoing in and around you. And I'm sure we will bring it to a very, very strong core health by working together. Thank you so much. See you soon.